first part of this broadcast, please go to the first link that you see about this, and know that this is going to wrap up this discussion. And I want you to just think about, what things were like a couple weeks ago before the coronavirus hit. Everything was more or less normal. Now there are massive changes. Things are happening very quickly. And we have to look at the bright side of what's happening. There's a move toward distance learning. That's a positive thing for education, but that means investments in technology are going to be needed. There's going to be a lot of different focus on what we can do to prevent the spread of germs and bacteria, and that's going to require not just hand sanitizers, but hand purifier and different types of items. You're going to start seeing masks, I guess, come about for not just health needs, but also fashion statements. So we're going to see a whole evolution of changes occur very quickly over the next few months, because as Dr. Osterholm from the Joe Rogan Experience, he says and declares this a coronavirus winter. It's a whole season. It's not going to, come and go overnight. It's going to come and stick around for a while. And this is where we have to be vigilant. We have to wash our hands. We have to keep our distance safely from people to make sure we don't get caught up in their breathing or the plumes that they breathe out. The challenge is people can be sick and contagious, or they can be contagious and not sick. And that's where things get tricky. And just with the declaration by the World Health Organization that this is a global pandemic, caused the Dow to go down. It caused the NCAA to say they're not going to allow, fans at games. It's going to have a huge impact on the economy. We already know that, but this is why we have to really step back and step up and see that a lot of work lies ahead. And some of the things that government should be doing right now is stockpiling foodstuffs and getting more food ready just in case there is a disruption to the food supply. So, meals ready to eat. Hopefully, not only will our military have enough for themselves, but there should be some form of MREs being prepared and stockpiled to distribute in communities that are hardest hit by the coronavirus. And looking ahead, anticipating hundreds of patients going into hospitals, as Dr. Osterholm predicts, we really have to think about how to protect our healthcare workers. They are on the front lines, and if it requires a different uniform or some kind of extra level of protections for them to have, we need to make sure that they stay healthy, because if our healthcare workers get sick, then who's going to care for the sick? That's a big problem that we really have to really be focused on as well. So if there's a method to really protecting people, if it's extreme distancing, let's just say, then that's something that we have to do. But I do want to read this letter to you that's from Italy that shares some very important information. So take a look at this. So hang on, let's see if we can zoom out. So this letter is, it talks about how what's going on in Italy is truly, it started out slow, and then all of a sudden it got, incredibly worse. And let's see, it disappeared. Where'd it go? Hang on. There it is, guys. Let me just make it bigger so you can see it. There you go. So we're going to read it together. Maybe I'm the closest thing you personally know to an infectious disease epidemiologist, and maybe not. I'm not an expert on this virus by any stretch, but I have general knowledge and training from studying epidemics that is applicable. So here are my thoughts. Now, this is from someone, one of our friends on Facebook posted this of one of their friends who's in Italy on the ground, and this is a letter, a pretty lengthy letter, but I'm going to read some of it to you, and I'll put the link up in the description. But it talks about exactly what I just described. We're going to see a tremendous increase in the number of United States cases of COVID-19. It's not because of a new pattern of the spread of the disease, but rather due to a major change in the requirements to be tested. So it was until yesterday, that was about maybe less than a week ago, that you can only be tested if you travel. That test requirement has since vanished, and now it's just obvious that it's spreading like massive. Now, the question is the panic legitimate? Now, that's a good question to ask. But as they point out, it's not a zombie apocalypse, because the death rate of 30 deaths per 1,000 cases is probably an overestimate. Now, previously in this segment, Dr. Osterholm predicted, over the course of the next 8 months, a lot of fatalities. But let's just see where this goes. I mean, hopefully the death rate is not as high. But here's where things get tricky with COVID-19. Unlike the flu, COVID-19 is not particularly dangerous for children. So that's happy news, but it's very dangerous for older adults, especially those with lung conditions or those with a compromised immune system. And it talks about, this letter goes on to say, what can we do? It talks about our global economy being hit. And I want to go down to, the recommendation of things that we can do. One is, there's no need to be obsessive, but just wash your hands. A little bit more effort goes a long way. Don't pick your nose. Yep, I'm going to have to tell that to a lot of people that I know. There was one note that came out suggesting face masks actually promote surface contamination by you always adjusting them, because you always have to touch your face. I don't know that to be particularly true or not, but the bottom line is, if you're sick, you should wear it. If you're not sick, you shouldn't. The coronavirus does not appear to be airborne in the sense that it doesn't remain floating around freely in the air. Now, this is someone in Italy saying this to us. Dr. Osterholm from University of Minnesota said otherwise, so there's something to think about. This person in Italy recommends that you sanitize the objects that you have, that you use, like your phone or your mouse. That's something to be mindful of. Social distancing is something that is to do. We talked about all of your travel plans are going to get screwed up, so look out for that. Now, I was talking to some college students, and they said they're just happy to be out of school, because now they can go vacation somewhere and they can do distance learning from a remote place. Now, look, I'm not encouraging anybody to travel if you don't have to travel, but I do think that college students in particular shouldn't be so cavalier about the risk of getting ill. Maybe their immune systems are much stronger, but nonetheless, I just know that some college students need to really think about the safety of themselves and their families if they're going to travel. But nonetheless, this is something that again, some common sense recommendations coming out of Italy. If you're sick, stay home. There's a good chance that communities will see schools canceled. We know that. And when that happens, what happens to the parents and the people that have to work? So, again, if we have to stay home for 2 weeks or all in all, they're recommending just stay home for 2 weeks and see what's going on and make sure that, maybe this thing will pass in 2 weeks. We don't know, but we do know that more and more people are getting infected. But this letter is by a doctor out of Italy that has some interesting thoughts on this, and I'm going to pull that down now. But there is an article that came out